I've sent reminders to several of our colleagues. I think they will join us shortly.
Okay. It's over to you, Dr. Evenson.
Yes, welcome, dear friends. Thank you for stepping in to learn more about the best practices for, first of all, designing and putting together the slides, and then the art of delivering the key message, especially to an international audience. And this afternoon, we have two distinguished speakers. One of the speakers is Dr. Ronald Rubega, who works with the African Palliative Care Association. He's a medical doctor. He's done a lot of work in emergency and humanitarian settings, and also in the space of public health. And our second speaker, Dr. Nuhamed, all the way from Ethiopia. And I know Nuhamed has done extensive work in the field of health, and that is largely shaping her PhD project work. And she has previously worked with the World Health Organization, and I know she knows the art of communicating effectively and putting together slides that are going to help you push the message forward. As we start our conversation, I'll kindly request you to just tell us who you are and where you're from. And in the meantime, I'll request our distinguished speakers for the afternoon to also speak to us. And after they've given us the oral tips, if you have your slides with you, I'll request you to volunteer, pull up your slide, and you can get practical tips and constructive feedback on your slides. Definitely for the conference, I trust you have about 10 slides. You're not going to come with, say, 55 PowerPoints to deliver a presentation. Our third speaker is also with us now. This is Dr. Dorothy Olet. Dr. Dorothy works with Hospice Africa Uganda. And Dorothy is a guru. I know she's been giving tips to those who will be presenting at the Africa Palliative Care Association conference, which is also slated for the 10th to the 12th of September, 2025. It is a busy year for all of us in the space of palliative care, and the busy year also comes with lots of learning opportunities. And now I'm going to turn it over to our first speaker, Dr. Ronald Rubega. Over to you. What are the practical tips? And those of us who are listening in, please feel free to put your questions in the Slido. After the presenters, we are going to have the Q&A. And if time allows, and we have people who have some slides, you'll put up your slides and you get some constructive feedback. Never know you stand to win a prize for the best oral presentation at the conference. Dr. Ronald Rubega, over to you.
Thank you so much, Dr. Eve, colleagues online, fellow mentors, and several participants. Good afternoon to those who are in other countries, good evening, and good morning. I have a small presentation that I will make. Let me just put over. Let me just share. So when you see the slide, you say, oh yeah, and then we go on.
Yes, oh yeah.
Okay. Well, thank you so much. So there are a few tips that I want to share to all of us regarding how to prepare and deliver an excellent oral conference presentation. And they're basically four. But then remember, there are other people who also may want to present pictures. There are those who look at pictures as well and they want to present their pictures. I also prepared about 2 slides for you. So we shall start right away. We shall look at the text opening. Definitely, you may wish to thank the moderators and all the people that prepared the workshop and all that. But this should not take more than even 10 seconds. I mean, it should really be right on. I'll go to the first tip that I'll post over. But you should remember that presentation success is equal to content plus connection with the audience. The audience is very important, as well as the content, and not either being more important than the other. The first tip is clarity and structure. We want to keep it simple. We give the introduction, that's a problem statement, then the key message. You can look at the methodology, and then the take home, which may be the results, which I believe most of our abstracts and all presentations may be structured in that way. And remember, we have limited time, so each and every word counts. To that, I said clarity is important. And this presentation may be limited to about 10 or 15 minutes, so every word should count. And then, importantly, is to begin by framing the problem or the context in 1 or 2 sentences, then move to your main message, that is, which the audience should be able to remember. Finally, we could go to tip 2, and I said that tip 2 is really the storytelling and engagement. And here, we want to look at well, I mentioned clarity already. Tip 2, we're looking at the storytelling, and we want to use the power of storytelling. People may forget data, but they rarely forget a story. So share a short story, maybe it is a case study, a vivid example, or even a personal reflection that links directly to your key message. And remember, engagement is not only verbal, but also you need to maintain eye contact, vary your tone, and use pauses strategically. And this makes delivery dynamic and it keeps the audience with you. I'm one of the members that used to really fail to talk at a big audience, and all my speeches were punctuated with and then later I had to replace that with pauses. So these days I really pause and then give, compared to so we should be able to look at that very keenly. And then we should look at the visuals and simplicity. Here I want to talk about a few. I want to talk about less is more when it comes to slides. Avoid overloading the slides with a lot of text, but instead use simple graphics, clear headings, and minimal words to support, not to replace your speech, okay? So the rule of thumb here is 1 key idea per slide. If the audience is reading too much, then they're not listening to you. So your slides should guide the conversation, but not to dominate it. This is really, really, really important. Let's keep the listeners engaged. As you're closing in, we should look at the recap. So in summary, excellence in all presentations comes from clarity, good storytelling. And I remember Dr. Eve had a webinar about storytelling, about a month ago. So a good presentation comes from clarity, storytelling, and simplicity. When you prepare, always ask yourself, what is the single message I want my audience to remember? If you can answer that and deliver it confidently, you will leave a lasting impression to everybody that is watching you, as well as listening to you. Well, to those that want to do a guide to presenting pictures, photos, or posters to a conference, I have 1 minute to finish. Choose pictures or postures that clearly represent your key message, and then sequence matters. Arrange visuals in a logical flow, problem, action, and then outcome. Then you should practice narration, rehearse what you will say as each message appears. Then nugget 2 is explain the meaning. Don't just describe what people are able to see. We all see this as a vehicle. You should be able to explain what this vehicle is all about. Again, use storytelling, share a short story or context around the image to make it memorable. Remember, people don't remember a lot of data, but they remember actually the stories, the actual storytelling. Pause for reflection, but this also gives the audience a moment to reflect. The second last slide I want to talk about is highlight key visuals. For example, direct attention to the main elements. Arrows, could be images, or even graphs. Speak the story. Use your voice to provide the introduction, the methods, and results. Remember, this is a picture. You may not have anything written down. You're talking about the picture or the poster. So it is specifically your voice that is doing the introduction, methods, and results. Lastly, summarize aloud. End with one clear takeaway that links back to the poster or the picture you're presenting. And at this point, you may be able to interact with all your guests and the delegates that are in there, that are listening to you. Those are the few that I should be able to talk about. And I want to say back to you, Dr. Eve. Thanks.
Dr. Rubega, thank you so much for the nuggets. And I like the tips that you have shared regarding the use of filler words. When you use a lot of filler words, your key message will not get across effectively. Therefore, I urge colleagues to pick that tip up and make sure that you use it at the conference. I can see there is a hand up from Jordan. Jordan, you're welcome to unmute and pose your question to the previous speaker. Mr. Jordan Kasekende, if it was a mistake, I'm going to invite our second speaker. And I'll go over to Dr. Nohamin.
Thank you, Eve. Thank you, colleagues, for joining. I wonder if we can see hands or in the chat know how many people are presenting today, because I know we'll finish in about 40 minutes and it might be the best use of everyone's time to spare more time for the presentations. If we could just do that quickly.
Yeah, if you have your slide ready and you would love to share your slide and get constructive feedback, please raise your hand or just put a note in the Slido. Elizabeth Nabidi, I don't know whether you have your slides and you would like to receive constructive feedback. Or Tebero. Good. So as she gives us the few nuggets, please just prepare your slide and be ready to share it with the gurus and you receive constructive feedback.
Thank you so much. I'll be very short because the previous speaker thankfully has given us all the relevant and important tips. for presenting in scientific conference and getting our message across. As I was preparing for this for today, I had 3 main phases in our preparation for our oral conference presentation. So the first stage is the preparation of our content, and it was described earlier very well that we need to know our audience. So I think for the upcoming APCA conference, we are speaking both to scientific experts, but of course there might be community members or experts in the field in the palliative care, as well as methodologically experts in the area. So we would like to find out, like assess the room, examine the room initially, and as we prepare our content for the presentation, have that in mind. That actually determines the volume of level of background and jargon we need to provide in that session. As Eve was saying, of course, there's time, 10 minutes, I think, for everyone allocated. So of course we cannot be very extensive in our preparation of content, but have who the audience is in mind when you prepare this, and have the goals shape your narrative. It was very well described earlier that we need to tell a story. So from our title, as we move on to the background, methods, results, and discussion and conclusion, we need to take the audience in that journey. So have that in mind as you prepare your content. And like my next phase is preparing the slides or designing the slides. So have a clear title, and if you can like have a very specific one that tells your message with that title, and you can take the audience through that journey as you move on through the next slides. You need to manage your time well as you move on. So in also preparing your slides, be considerate of what you put in each slide, number of bullet points or number of diagrams and descriptions, and everything you put needs to at least be described very briefly. So be mindful not to put too much per slide. And your slides need to be concise, or there needs to be consistency in terms of font size and type. So and your visuals also, in terms of the colors you use, need to be very accessible for the audience. It was said earlier, less is more, especially with this PowerPoint presentation. Also for anyone presenting posters as well, don't put too much so that your key message comes across clearly. Yeah, with your diagrams, please label everything. You as a researcher or the main investigator would know everything, but just be mindful of the legends you put there, like abbreviations may need a clear description. So have that in mind. Yeah, then your delivery of the slides and the presentation. We all need to know how to manage our nerves. So everyone gets nervous, but it's about using that energy and excitement for the good to get your message across to the audience with that little time. Learn to pause and breathe, and be confident that your research and your abstract is selected because it's important and you have something to say, you have a message. So deliver that confidently, engage with the audience, as was said earlier, with smile, speaking clearly and confidently. Your first message and your last take home also matters. So rehearse that, like practice it, and get that message across as powerfully as you can. And with the questions and answers at the end, I hope everyone will have the chance. Listen to the questions. It's not, you're not listening just to respond, but also to respond as you would like your message to be heard. So listening to the question before kind of contemplating the questions is important. and you may not know everything. You may have like a preliminary data. So be transparent also in what you know or can say at that point, and what you can follow up on with later. Yeah, acknowledge your research team, funders, sponsors, and the organizers. I think that's also said earlier. You would want to arrive early, like get your tech ready, have a backup. It's good to have water next to you, just hydrate, everything that helps you kind of distress and be calm. You may want to also dress professionally if you're comfortable with that, or go casual, like anything that's helping you to concentrate or focus on communication, good communication on that podium. Thank you. Let me give the floor back to Eve, or any questions are welcome. Thank you.
Yeah, excellent. I love those tips. Going out confident and knowing that you have a key and important message to deliver. And most importantly, the fact that your abstract was appraised by a rigorous conference scientific committee, and you won yourself an oral, as most of us just won ourselves posters. And I know with the poster, there are also advantages, and we are going to talk about the bolts and nuts of posters later. But here we are today, focusing on the orals. I have a question from somebody. They say how to get the APCA conference logo. Please note that we have an unofficial conference slide deck, and you can download that from the APCA website, and it will also be sent to you as a speaker. And alongside the slide deck, you'll receive some instructions on how many minutes you have and what to expect and how to prepare yourself as a speaker or poster presenter. I'll just also double check to see if we have questions. There is a question that if I started my presentation with a story, is it possible to end it with a story as well?
If you might be the expert here, I don't know if the question was directed to me, but of course you tell a story to make to get your message across. So it's good to have relatable content, which a story does, but you don't want, I guess, make sure that your key messages are like at the start and at the beginning saying the same thing, and yeah, working for you rather than only engaging the audience. So use them for your advantage.
Excellent. And we should take advantage of the creative arts and liberal arts, and we power up with stories, because life is about stories. Great. Now I'll invite our next speaker, Dr. Dorothy. Over to you, Dr. Dorothy.
Thank you very much, Dr. Eve. And I would like to thank the previous speakers, Dr. Lubega and Dr. Nohamin. You've made my life very easy because you've gone through the basic points or the key tips that are needed for excellent oral presentation. So it's important to focus on the preparation, clarity, and audience engagement. So it is key to know your content, because as you're preparing, it helps you master your content very well or thoroughly. You familiarize yourself with it, with the subject matter, and this will help you to be very confident. Because if you're very familiarized with your knowledge and you're confident, it will help you to engage the audience and respond to the questions effectively. So you also visualize yourself as leading the audience through the topic or through the discussion. It's also key to define your purpose. what do you want the audience to take from your presentation? What is that one key point that you want to deliver? Clearly outline the message you want to convey. A well-defined purpose helps you to organize your presentation, and it helps to keep the audience focused. Like most of the tips have been shared by the previous speakers, but I also want to put emphasis on the point of using the visuals. Dr. Lubega had talked about it earlier. You shouldn't make your visuals very crowded that the delegates or the audience cannot easily make out what you're saying or what you're presenting to them. It needs to be clear, to the point, and it's also in relation to the purpose that you defined when you were organizing your presentation. So it's very key to organize and then also practice. Practice and practice, because remember we have a time limit and you have that limited time to work within, because if you don't keep your time, you're going to disorganize the flow of the workshop, or you'll be stopped by the workshop chairs and co-chairs. So it's key to be very mindful of the time that you have been given. So practice will help you be able to attain this time. And then also you need to show enthusiasm, that you're really enthusiastic about your topic, and then also leverage the body language, the facial expression, eye contact, show that you're having your audience at bay and you're in control of your presentation. And it's also important to use your voice very well. Don't make it very monotonous or so, because if you make it very monotonous, it may become very boring to the delegates and they may easily switch off. So it's key to use your voice very well and be consistent, relax, and enjoy yourself. Because when you relax, you'll be able to speak very well and confidently as you're speaking to the delegates. And then as you're concluding, it's also key to remember your purpose. What is the takeaway that you want the delegates to have from your presentation? It's very key that the key points are re-echoed and summarized. Thank you very much. I submit. Over to you, Dr. Eve.
Excellent. Who is not ready enough to deliver their presentation come September the 23rd to the 26th, or even come 10th to the 12th at the Palliative Care Association of Uganda conference? I'm now going to open it up for a Q&A. And like I said, if you have your slide deck ready, please be the good teacher. Share your slide deck and we give you constructive feedback. Tebelo, do you have your slides?
Dr. Eve, because I'm just doing the poster, I have not prepared the slides. I thought it's only the poster that I will be presenting, but let me know
You can also present the poster. I know you usually develop it either in Word or on a slide and then get it printed. So if you have your poster, you can still share it and you get some feedback, as Jordan Kaseke prepares himself to also share.
Oh, okay. Let me get it sorted in a couple of seconds.
Okay.
Thank you.
Jordan, are you ready? Unless you invest in the practical aspects of this session, you're not going to pick the practical tips of excelling at this.
Actually, I have it.
Yes, Jordan, you're welcome. Please share.
just a minute. If somebody is there, then no problem. I was ready.
Jordan, I didn't hear you. You're not ready?
I'm not ready.
You share what you have. You'll never be ready. Just show up.
Okay, no problem. Let me see here. Let me take.
This is a very welcoming and friendly audience, and you will receive some good feedback. And I think this reaffirms the assertion that some of us just hate public speaking, and yet we have to do it because we have important messages to put across. Tebelo, are you ready?
Yes, I think I'm ready.
Excellent.
Let me see. How do I share this now?
Please look at that green button and at the bottom of your screen, you'll see several icons, and one of the icons is green.
I only have for chat. I've got a raise hand, a Q&A, transcript, and that's it.
Giving you access to the account. You can go ahead.
You don't have the green one saying, okay, I can.
No, I don't have for the share slides.
No problem. Let's enable you to share. Oh, how can I make her co-host? Mm. Mm.
You are now a panel. You can go ahead.
Eve, I think Tabelo is just made a panelist, so she should have it now.
Okay, great. Over to you, Tebelo.
Tabelo, for a brief second, we were able to see your screen. So if you could also reshare and then go to the presentation. We can now see your screen, but I don't know if you're muted. Do you want to go through your presentation before feedbacks? Tabelo, I think you can stay in the screen on the screen that you are now. We can see title, background, and part of the aims. Then maybe you talk us through the sections, then we can carry on to the others.
Tebelo, well done. Please take us through.
I see that you're muted, Tabelo. I don't know if you're speaking.
We can hear you.
Can you hear me?
Yes,
Yes, please.
Oh, okay. Sorry. Yeah, I said Tibello Lifin, palliative care nurse, currently working here in UK. However, trying to support my home country, Kingdom of Lesotho, in terms of trying to see how we can make palliative care accessible. So this poster is all about the work we did in collaboration with Pal Chase, APCA, Palliative Care Works, and Project ECHO through utilizing the online resources in whereby we were connecting with the multi-professionals from different health facilities back in Lesotho to make sure that we all have the basics of palliative care to be able to make a difference in how we take care of our loved ones. So I think this is just our early draft, which as I said, we were with Pal Chase and other stakeholders in making sure that we all collaboratively deliver. And we are still grateful for APCA for making access to the online platforms to enable us to connect with this many of our registered nurses, the doctors, and social workers. So this is it. And the results were just to continue to increase awareness and advocacy in the Kingdom of Lesotho, as well as ensuring that we establish champions within the local and district hospitals in any kind of facility, whereby people will appreciate the concept of palliative care in a holistic way that we need to be attending to the needs of those that we serve. So I think this was just a taster and a way to really get people's buy-in from the compassionate side of them in developing their interest for the face-to-face training as we continue to implement and support them to make change within their workplaces. As a matter of fact, from 2024, we started delivering face-to-face in collaboration with the ICP as well as Palliative Care Works. And so far, we have had 3 cohorts. This year in February, we delivered the 2 weeks course to different hospitals and academic institutions within the health sector. This upcoming October, after we have attended APCA conference, we have got another 1 week whereby we will be delivering training to another remaining hospitals. So we want to really say the partnership strategically, working together and collaboratively taking advantage of the modern technology can still go along even when the finances for the face-to-face trainings are not readily available. Therefore, we really want to appreciate all the stakeholders and our APCA team for enabling us to make small steps, but in a consistent way in Lesotho, which has really given us a good results to see the interest that is now in the country for the face-to-face training. And good news is that this moment advocacy through APCA platforms has even enabled us to get more support for funding. As a matter of they are finishing their first hospice facility in Lesotho by the end of September, hoping to start services early December. Thank you.
Thank you so much, Tebelo. Any feedback for Tebelo? Kindly put your poster up again.
Thank you
Yes,
so much,
let's go to
Tabelo.
the
If you
top.
scroll, if you scroll up to the title and initial sections of the poster, please. I
So
wonder
we
if Dr. Ronald or Dr. Dorothy want to go first, then I'm happy to provide feedback after that.
Okay, Ronald, over to you. Do you have any comments?
Not at the moment. I'm still also analyzing the photo, but the poster rather. But maybe in the next 1 minute I'll be able to have one. I'm looking for. Back to you.
Dorothy, any comments? First of all, you can even commend Tebelo for the great work.
Thank you very much.
Thank
you very much, Tebelo, for the great work. Your poster is very visually attractive, like you can immediately see what the title is and what the project is all about. You really did a great job. You put in a lot of effort and then also following the guidelines. So basically, I think the poster, the way you've presented it is okay. It's well organized. I was just wondering if you could be able to justify the content, like in the background. I thought it would look neater when it's justified, or did you want it that way?
Thank you for that feedback. I think it will be something that we can look into to justify it. Yes.
Okay, thank you. I submit.
Okay, thank
Otherwise, well done. Yeah.
Thank you.
Yeah,
Great.
thank you. Thank you, Tabelo.
Over to you.
Yeah, thank you, Dr. Eve. It was really a nice presentation. I could see your enthusiasm and the efforts by you and I think there were many collaborators, so their efforts and the impact of this work, it really shows. So I think when you are putting up this poster, you will be very much engaging your audience through the passion you put into presenting and disseminating this work. I wonder if the color codes behind your title have meaning. In that case, please keep it. But I was just seeing, does the contrast with the title and the presenter, which is the white, work okay with the background color mix? So yeah, you can discuss with your research team just to make it more visible. That's what I mean. Yeah, in terms of length of the title, I think it's okay. You can keep it. It shows where you did the work and the focus of the work you're presenting. That's good. And the background is brief. I think that's very well done. And you have the abbreviation is clarified by what you have done in the title section. That's good. I would like to see the aim and methods in a separate box if you can do that easily. I know you're struggling to fit in everything there, but if the aim is coming clearly in a separate box, then the method follows. I think that would be best for the audience. Yeah, and you have very, very detailed methods there. I wonder if you can summarize some of the, your methods there with the numbers very briefly orally, and like highlight or put in a bigger font what you want the clear methods or the frame of your methods in this section. And I like the pictures. I think it relates well to what you're presenting. Then if you, yeah, thank you. If you scroll down a bit to results and conclusion section. Maybe for this poster presentation, no need to have references, but if you want to highlight, or especially if you have published work from your collaborative research, I think you have small space to put references there. Yeah, I wonder, rather than having too many numbers on the method section, if you can show us in the result section the impact with figures. So how many sites have opened? You were actually telling us as you were describing the results, but most of what was done currently lives in the method rather than the results. So if you've done the work already, you can bring these numbers and like demonstrate with figures your impact in the results section. Thank you so
Okay.
much. Yeah, over.
Great. Very well done, Tebelo. And I thank everybody for the constructive feedback on this great work. Never know, you may win the best poster presentation. And next week, we are going to get introduced to Canva. We are also going to look at color schemes and the whole theme of color. Those who are working on posters will then have an opportunity to see if they need to improve their visuals or color selection. And even those who are using the conference slide deck, still you can pick a nugget or two to help you visualize your presentation and put your message across more effectively. Is there anybody else who has their slide deck up? I think we have just about 10 minutes. If you want to take advantage, please do. Yes, is there a hand up or something? Yes, please unmute yourself and raise your question. Thank you. Whose hand was up?
Yeah, Dr. Eve, I'd sent you a slide. It's not my presentation, but maybe it would be a good one for learning because I just received it for editing, but I think it would be a good one. It's not the best. I know it's not the best, but maybe for you have it, then you would share. Hello, Dr. Eve.
Yes, over to you, Liz. When you tell me next slide, I'll move.
Yes, hello everyone. I'm presenting this. This is on behalf of Vicky Jemima, one of our volunteers, and it's about experience of volunteer social workers that support patients in Mulago, case of Mulago Hospital. Next, Eve. So palliative care goes beyond managing the symptoms. It's holistic in nature, and the volunteer social workers play a vital role, yet they are overlooked in their role as part of the multidisciplinary team. Next. So this aimed at exploring the volunteer experiences that work with the palliative care team in Mulago, with a major focus on their challenges and contributions in providing care to these families, patients and families. Next. So this was a qualitative study that was designed to, with in-depth interviews to 6 volunteer social workers providing social and pastoral work to the patients and families in Mulago National Referral Hospital that need palliative care. Next. So what were the results? The results are that volunteers engage in different activities, and these include counseling, advocacy, emotional support, facilitating connections with the community resources, and they described their experiences as rewarding and life-changing, highlighting the importance of emotional support in palliative care. That they too listen and support the patients. Next. So as one of the participants noted, being able to provide companionship to the patients and families has been highlighted by one of the volunteer workers And another volunteer shared the experience as having learned so much about resilience and hope from the patients and the families I have supported. So they emphasized the value of being present and listening actively to patients and families. And with one volunteer saying, sometimes it's not what they say, what you say, but rather what you are there, that you are there to listen and support. Next. So they also, social work volunteers also provide guidance and help to patients to navigate the complex health systems and offer companionship to the patients and families. Next. So as part of their experience, there were some challenges, and these were issues like limited resources, emotional strain, misconceptions about palliative care. But despite all the challenges, they reported that they remain resilient and adaptive. Next. So what are the contributions? By collaborating with healthcare professionals, social work volunteers, enhance care quality, highlighting the importance of integrating volunteers' efforts in the holistic palliative care frameworks. So in conclusion, incorporating volunteer social workers in palliative care frameworks is crucial for enhancing holistic patient support. Next. Yeah, so in their recommendations, they recommend strengthening training, policy inclusion, and support structures that can empower volunteers to navigate challenges more effectively and recognizing their roles, not only because this does not only foster a more compassionate care model, but also reinforces the importance of social support as an integral component of palliative care. So thank you so much, and acknowledge all our donors, our supporters for this work. Thank you.
Excellent. Thank you so much, Liz. Let's have some comments from members in the house. First of all, how she came through with the voice and all the other tips. And then we will also make a few comments on the slides. I know we have just about 5 minutes. So let's give some constructive feedback very fast. Who wants to go first?
Dr. Eva, I will go.
Yes, please.
Okay. Well, one of the aspects we noted is that slides should not be really crowded. Indeed, her slides were not crowded. And then one thing I also want to note that she was saying it's not the best. Yes, none of us has the best slides. We all have slides which we just put a lot of effort to get through. So when you're presenting, don't start thinking I'm not the best. You are the best when you have the microphone. So we should not forget that. And then I saw several pictures. You'll find a lot of people ask if you have consent of those pictures. So just also you could acknowledge the people who are appearing in the pictures as well. Thanks, and over to you.
Thank you.
Thank you, Dr. Lubega. And I think for me, the very first slide, the title of the presentation needs to probably have a bigger font so that people can recognize that this presentation says about experiences of volunteer social workers supporting patients. Right now, you can't differentiate the title of the presentation from the authors. Probably you could put a line or change the font, so that it is more visible.
Okay.
And yes, we need to have the caption credit. We have people's photos who took the photo, and I trust that the unit has consent. And I'll give this example here. The header says aims, and then the content says the aim is to explore. I think if you would just put aim up there and just mention what the aim is, to explore the experiences, etc.
Thank you.
And at times, I had an examiner who liked asking me this question, that if you have one statement on a slide, why do you have a bullet point? And at that point, I realized that people who deal in calligraphy, design, and art, they care so much about every tool you use in your presentation. Therefore, if this is just about one thing, the study design, and it's just that one sentence on the slide, why do you need the bullet point? You need to think about that. Same here, and here I think we have so many things in there. We could unpack the slide a bit and maybe put some bullet points so that it is easy for the reader to digest the content that is being shared. Otherwise, there is a bullet there and then a cluster of content, and it is very difficult for a reader to easily digest what is being communicated. Liz, I hope that feedback can be sent back, and never know what our dear volunteer can win. I hope there will be a best oral presentation. I think largely those are some of the things I would love to point out, and then maybe I would color the quotes or just hang them a bit so that they stand out and the person is able to see that this is a quote from so and so.
Okay.
Yeah, if
Okay,
second your
Yeah, I think
there.
those are the few comments I want to point out, and I'll give other people an opportunity to also give some feedback on this excellent presentation.
Yeah, well done, Liz. Just a few things for me. As you were just displaying the results there, Liz, I wanted to mention, maybe have your interpretation or themes on the left, then the quote on the right, and you can put the quotation mark. That's easy to identify them as voices from the participants. Also, your first result slide has results as a title, but then it says continued, and then we have challenge, then we have contributions. So the structure was not clear to follow, especially if someone was engaging with the slides, midway. It would be helpful to have an outline first presented, then each title kind of saying where you are actually, rather than continued or your themes as challenge, for example. But well done. Thank you, Liz.
Wow, thank you so much for the feedback, and that is helpful because, yeah, I hope, I wish my volunteer was on the whatever, but I'll give back I'll give the feedback.
And we have Lisa online here.
Okay.
Lisa, we have you online. We hope we can get a small award for the best oral and best poster presentation. Because you can see we are putting in the energy to excel at these conferences. Thank you so much, our distinguished presenters of the day. And I want to sincerely
Dr. Eve.
Yes, Dorothy.
I just have one comment to make.
Yes.
Most of the comments you've made them, but I thought it would also be important to know how many interviews were done, because you just said you interviewed 6 volunteers, but you didn't tell us how many interviews were done. Thank you, I submit. Sorry for the interruption, Dr. Eve.
Yes, that is important. The precision and accuracy. Liz, please document that and send it through.
Okay, I'll do that.
And Liz, thank you so much for accepting to share the slides to help all of us learn. Tebelo, thank you so much for accepting to present to help all of us learn. And on behalf of the African Palliative Care Association and Ministry of Health, Botswana, I want to thank our distinguished speakers of the day and all the presenters who have put in the time to come and get some nuggets for excellence. Thank you, and I wish you a proudly blessed weekend ahead.
Thank you, Dr. Eve. Thank you all.
Thank you, Dr. Eve. Thank you all. Bye-bye.
Thank you.